Have you heard the news? The World Health Organization, or WHO, is preparing to officially endorse the use of weight loss drugs to treat obesity in adults. Yes, the same organization that guides global health policies is now stepping into the world of prescription weight loss medication, and this is a major shift. In today's video, we're diving deep into what this decision means, why it matters, and how it might change the way obesity is treated around the world. If you're curious about how science, medicine, and policy are evolving together, make sure to hit that subscribe button and turn on notifications, because this topic is going to be one of the biggest health stories of the year. Let's break it down. According to Reuters and other credible sources, the World Health Organization is expected to release new guidelines that officially support the use of weight loss drugs as a treatment option for adults living with obesity. This would be the first time the WHO is backing such an approach on a global level. Now, this doesn't mean everyone will suddenly be prescribed weight loss pills tomorrow, but it does mean that health ministries, doctors, and insurance systems around the world will take this recommendation seriously and possibly change how they approach obesity treatment. You've probably heard the names Ozempic, Wegovy, Mounjaro. These are some of the most talked about medications in recent years. They're part of a class of drugs known as GLP-1 receptor agonists. Originally developed to treat type 2 diabetes, they have shown remarkable results in helping people lose weight. How do they work? These drugs mimic a hormone in the body that affects appetite and blood sugar control. They make people feel full sooner and reduce the urge to eat between meals. In clinical trials, patients using these drugs lost anywhere from 10 to 20% of their body weight, and in many cases they kept it off. The WHO doesn't make decisions lightly. When they support a medical treatment, it sends a message to healthcare systems worldwide that this is a legitimate and science-backed approach. Their guidelines influence public health policy in developing and developed countries alike. For years, the primary recommendations for obesity were diet, exercise, and lifestyle changes. While those are absolutely important, they're often not enough, especially for people with severe obesity or underlying metabolic issues. By including medications in their guidance, WHO is acknowledging what many experts have been saying for years: obesity is a complex chronic disease, not just a result of poor lifestyle choices. Quick reminder, if you're finding this informative, give this video a like. It helps the channel grow and gets this important topic in front of more people. Besides significant weight loss, there are other health benefits tied to these medications. Studies show they can improve blood sugar levels, lower blood pressure, reduce the risk of heart disease, improve sleep and mobility, even reduce cravings for addictive substances like alcohol or nicotine. For many people, these changes dramatically improve quality of life. No medication is perfect, and these weight loss drugs are no exception. Some common side effects include nausea, vomiting, diarrhea, constipation, stomach pain. And because these medications affect the gastrointestinal system, some people find them hard to tolerate. Plus, once you stop taking them, the weight can come back if other changes aren't maintained. Then there's the cost. These drugs can be very expensive, especially in countries where they aren't covered by insurance. In the United States, for example, Wegovy can cost over $1,000 per month without coverage. This is where WHO's endorsement becomes especially powerful. In many low and middle-income countries, obesity rates are rising rapidly, but access to high-quality treatment options is limited. With WHO backing these drugs, it opens the door for global negotiations on pricing, potential inclusion in public health programs, and better access for people who otherwise couldn't afford them. It also puts pressure on pharmaceutical companies to make these treatments more widely available, and possibly lower prices for developing nations. Why now? Obesity has become a global epidemic. According to WHO, over 1 billion people worldwide are now living with obesity, including over 650 million adults. And it's not just a cosmetic issue, it's linked to serious health conditions like diabetes, heart disease, and certain types of cancer. At the same time, the science has caught up. We now have safe and effective medications that can help people manage their weight long-term. So, WHO's decision is part of a broader recognition that we can't ignore the problem anymore, and we have tools to address it. How might this affect you? If you live in a country that closely follows WHO guidelines, your national health authorities might begin to recommend these drugs to doctors, approve them for public insurance, subsidize them for lower-income patients, and include them in national obesity strategies. That means, if you or someone you know is struggling with obesity, access to medical treatment may become easier in the near future. What should you watch out for? With popularity comes hype, and sometimes misinformation. These drugs are not for everyone. They are prescribed for people with a BMI over 30 or over 27 with other health issues like high blood pressure or diabetes. They are also not a quick fix. Medication needs to be part of a comprehensive plan that includes lifestyle support, mental health care, and long-term follow-up. So if you're considering these treatments, talk to a licensed healthcare provider. Don't just take advice from TikTok or Instagram. Final thoughts. The World Health Organization endorsing weight loss medications marks a huge moment in global health policy. It signals a new era in the fight against obesity, one that treats it as a serious medical condition with real, science-backed solutions. But like any tool, these medications must be used wisely. With the right oversight, they can help millions of people live longer, healthier lives. We'll keep tracking how this story develops, especially as WHO releases its official guidance in the coming months. If you want to stay updated, don't forget to subscribe and hit the bell icon. We cover the latest health news explained in plain English so you always know what's happening and why it matters. Thanks for watching. Stay informed, stay healthy, and we'll see you in the next one.